When we're at this institution, we are really covering a variety of different types of neurosurgical issues, really the full breadth of neurosurgery. When it comes to oncology care, it's making an impact and difference in people's lives. These are people that are oftentimes caught in the worst moment of their lives.
My job required a lot of different tasks, and I began recognizing that I was having difficulty juggling between those tasks. I realized that something wasn't right. And so at that point, I called and got an appointment with my primary care physician in order to let her check me out and see what was going on. They ordered a scan of my brain and saw something there, had a doctor in to check it more thoroughly, and they came back and told me that there was a tumor there. So they arranged for an ambulance to bring me here, and within 2 days, I had surgery. It was overwhelming. It was very scary. That's not news that anyone really wants to be told. The next brain scan, it was clear that there was still just a tiny bit of tumor matter left from the original surgery. The doctor who performed that surgery suggested that I move over to one of his partners who was more of a specialist. He asked if I would be open to the insertion of GammaTiles.
I discovered GammaTile therapy in my search to make sure that we are providing our community everything that can be available to our patients.
The way I explain GammaTile, it's a treatment method in which we can precisely place radiation sources right up against areas at highest risk for recurrence, and that the radiation dose does not penetrate very far, so we're able to safely confine it to a small volume, a small space, so that we can avoid treating areas of the brain that we don't need to.
The procedure from the neurosurgeon's perspective is actually, I think, probably the easiest of all of it. It's an additional couple of minutes added to the operation's overall length of surgery.
Once we close up the wound, there's no at risk of exposure to family members or loved ones. So we tell them you don't have to avoid anybody, you don't have to go into quarantine or anything, and that's the beauty of this treatment.
After the surgery was done and the GammaTiles inserted, I didn't feel any different really than I felt after the original surgery. It's been about 8 months now since I had the surgery. The first brain scan looked really good. The tissue in the cavity around where the tumor was taken out, there was nothing there in terms of any cancer cells at all. I believe in the treatments. I believe in being positive. I believe in prayer, family support, friends around you who will support you and walk with you through this. And there are doctors and medical professionals like Dr. Franklin and Dr. Wynn who will do everything they can, give you every option available.
I'm very honored and very blessed that I'm able to make an impact on people's lives that way.
I'm really passionate and want to make sure that the community that I serve has every available option to them.
I'm not ready to give in, and I'm not going to. And I would encourage others to have the very same attitude towards this. When it comes to GammaTiles, I'm a big supporter.